Hello, my name is Teresa Hernandez. I'm with United States University. I'm here conducting a health history for my class Advanced Health and Physical Assessment across the lifespan. This is going to be uploaded and viewed by my professor and other classmates. Um, can I confirm your name, please?
Tomas?
And are you over the age of 18?
Yes.
Okay, do you consent to me recording this and posting it on YouTube for educational purposes?
I do consent.
Okay, can you state your full name, please?
Tomas Pondo.
Okay, I'm gonna be your nurse today and I'm gonna be conducting a health assessment on you. What is your date of birth?
7/13/90.
Okay, how old does that make you?
32.
Okay, and what do you identify yourself as?
Male.
Okay, I'm here with a 32-year-old male. And what is the highest level of education?
Some college.
Okay, what brings you in today?
Just here for my annual checkup.
Okay, and do you have any other complaints at the time?
No, I just wanted to come in to get my annual checkup, and I just been feeling a little weak those last couple weeks.
Okay, tell me more about the last couple weeks. What have you been feeling?
Just tired, like more tired than normal, I guess you can say.
Okay, any additional symptoms that you've been experiencing other than just tired?
Just really weak.
Okay, is the weakness affecting your daily activity?
Just sometimes I feel like wiped out at the end of the day quicker than normal. I mean, most of my days are the same, but there's just days, I don't know if it's mental or just exhausted, like I just ran for a long time.
Okay, and how do you explain the change? Is there something that's changed in your daily routine?
No, just I think between work and personal life, no, not really. Just like I said, maybe I'm not resting enough or something.
Okay. What type or what's your medical history?
I don't really have any medical history other than about a year ago I had a craniotomy done.
Okay.
I had a stroke on Thanksgiving and I woke up a week later in the hospital.
Okay, tell me more about the craniotomy.
So I guess I fell and I hit my head on the concrete and I guess an artery burst and they had to go in and relieve the pressure and the bleeding, and I woke up a week later. Basically, I don't have any recognition of the day. I only remember the day before.
Okay, so you lost consciousness.
Yes.
Okay, and how long were you in the hospital?
A week.
And you said you had a surgery. Did you have to be on medications?
When I got discharged, they had me on like gabapentin, some other muscle relaxer. I don't really know the name of. They did give me a controlled substance for pain, but I don't like taking that stuff, so I didn't really use it. And I used a muscle relaxer when I did like really bad migraines because I had like 24 staples in my head at one point.
Did it cause any other problems to your vision, hearing?
I always needed glasses before that, and finally after my vision got pretty bad, so I went and got glasses about 4 months ago.
Okay. And after the hospitalization, did you follow up with the neurologist?
I did have an appointment with a neurologist, but it was 6 months down the road. But after my surgery or after I got discharged, I followed up every 2 weeks with the surgeon that did the surgery, the neurosurgeon. He did a CT scan every 2 weeks until it was negative or until he saw that there was no damage or anything, then he signed off. and he took me off all the medications that he had me on.
Okay. So you currently are not on any medications, or are you taking any other medications?
I do take Tylenol when I get a bad migraine, but it's not often. It's probably once or twice a month, if that.
Okay. And how long ago did you say that happened?
This is gonna be the second year, so a year ago from Thanksgiving. So yeah, like a year and a half.
Okay. Do you manage any other symptoms from that surgery?
No, I haven't had any problems. Just the migraines. I do get like a daily like migraine. That's another thing I wanted to bring up too, because of this checkup. I do get a pressure in the back of my neck, pretty bad.
Okay. And when that pressure accumulates, do you have to take anything over the counter, or?
No, I kind of like let it go because it just feels like someone's squeezing my neck. But just when my headaches get so bad, I do take Tylenol. I should probably follow up with a neurologist.
Yes. For the Tylenol, how many do you take?
They're 500 milligrams.
And how often do you have to take them?
I just take them probably one time, twice a month.
And that usually helps?
Yeah, it controls it. It settles it down enough that I can just like rest a little bit.
Okay. So any other surgeries other than that?
I did have a right inguinal hernia when I was 16. They did a surgery for a hernia repair. I haven't had any problems though since.
Okay, how old were you when the hernia occurred?
I was 16.
I was 16, and you said the surgery, you had surgery for that as well?
Yeah, I had to have it repaired because I got it repaired for football. I injured it. I got it during football. I had to get it repaired so I can play the next year.
Okay. And any other problems other than the hernia or after the hernia surgery?
Not for the hernia surgery, but I ended up getting injured later on in college when I played football. I separated and cracked my humerus on my right shoulder.
And did you have to have any surgery for that?
They recommended it, but I didn't do it. I just healed normal, but I did do 6 months of rehab.
Okay, and do you feel like the rehab helped?
It did. It was really painful, but I haven't. My shoulder doesn't lock up or anything.
Okay. Let's see. What other surgeries did you have other than the hernia and craniology?
Other than the hernia and the craniotomy, that's it. That's all the surgeries are done.
Okay. You said you're not taking anything over the counter right now, or just the Tylenol?
Tylenol, but I do take vitamins every day. I have a multivitamin that I take for men, and then I take an extra magnesium, potassium, and zinc.
Okay. And no prescribed medications, correct?
Correct. No prescribed medications.
Okay. Any allergies to medication?
No.
Do you have any food allergies?
No.
Do you have any latex allergies?
No.
Do you have any seasonal allergies?
No.
Okay, so now we're going to go ahead and talk about your family history. Let's start with your mother. Do you have any knowledge of her medical history?
My mom did have non-alcoholic liver issues, but she changed her diet and she gets her blood work done and everything's pretty much back to normal.
Okay, how about your father's medical history?
I've never known him.
Okay, how about your maternal grandparents?
My grandparents do have a history of hypertension. They're on medication for that. My grandma's diabetic, and my grandfather has history of stroke. He had a stroke at one point in his life.
Okay, so and you said you had no knowledge of the paternal.
My father's side, yeah, I don't know anything about it.
Okay, so are you sexually active at the moment?
Yes.
Okay, and are you using any protection?
No.
Okay. Are you using any tobacco?
I don't. I chew, but they're not tobacco. They're like these nicotine pouches. They're just these little white pouches.
Okay, and how long or what? Since what age did you start using those nicotine packets?
In college, I used to. Someone told me that they help because where I went to college, it snowed. They said they help with the cold, so I started doing it, and I don't. I used to not do it as frequently as I do now, so I stopped for a couple years. But lately, probably chew about 3 times a day.
Okay, and have you ever thought about quitting?
I do quit sometimes, but lately I'll quit and then I say I quit and then it's too hard. So then I get back on it because it helps the day go by, I
Mm.
guess.
Okay. Have you ever tried any nicotine patches?
No, I did try nicotine gum and it made me really nauseous.
Okay. How about alcohol use?
Just social when I get with my friends on the weekend. It's nothing crazy. It's nothing to get, you know, alter mental status. It's just 1 cup of like whiskey on the rocks.
Okay. And you said once a week, is that correct?
Yeah, usually like on a Saturday evening.
Okay. So how about any drug use? And do you use any marijuana, any
No.
pills or anything like that? No? What's your marital status?
Soon to be married.
Okay. Congratulations.
Thank you.
Any what's your occupation at this time?
I'm a paramedic.
And do you find that to be stressful?
Yeah, we work 24-hour shifts, so we run about 20 to 22 calls a day. So it can be stressful. I think maybe that's why sometimes I feel weak because my sleep pattern is really off.
Okay. And what do you do for the sleep?
So sometimes I take a melatonin because I heard that resets your sleep cycle. So when I get off shift like that week, when I'm done, I'll take a melatonin and try to reset it. But my body just wakes up on the same time every day, whether I'm off or whether I'm on. So I average probably about less than 6 hours of sleep a day.
So would you say that you're stressed? Do you have stress in your life?
Between work and personal, just the normal stress.
And how do you cope with it?
I try to exercise every day between 15 to 30 minutes. I do like a boxing simulation. So sometimes, depending how long I do it, I get a really good, sweat out of it or just something to stay active.
Okay, so you say you're moderate active.
Yeah.
How's your diet?
I fast for 18 hours a day. I have like a 6-hour eating window. Depending though, sometimes I can't eat. I'll eat at least 1 meal every day. But maybe I should try to eat more than 1 meal because those are the times when I guess maybe that's why I'm feeling weak.
Okay. Yeah, you should try to have a good balance, especially if you're working out and having long hours of work. So definitely try to do so. Try to readjust your eating habits and adding some good protein and some vegetables. Do you take any protein supplements?
I have a protein shake every day after I do my workout.
Okay.
But it has espresso in it. So it's like I have a normal protein and then I have a protein powder that has espresso and I mix it to get me through the rest of the day. And I do drink a cup of coffee every morning when I wake up, like immediately when I wake up.
Okay. And how much of caffeine are you taking in?
I don't know how many milligrams it is. I know the espresso is equivalent to 2 shots of espresso in the protein powder. But I probably have 2 cups of coffee every day. So 1 in the morning right when I wake up, and the other one about 3 o'clock in the afternoon.
Okay. And how about your immunization records? Do you have any knowledge of
I am up to date on my immunizations. I did get the COVID shot twice though.
And did that cause any problems?
The first time I got really, really sick. I had a fever, a cold. I didn't get loss of taste or anything, but I had like the chills really bad. I took some ibuprofen and then it went away after like 2-3 days. And then the second time I got the shot was when I was in a coma in the hospital.
Okay. So do you get headaches other than just your regular migraines, or?
No, I just get I feel like it's like a like a tired migraine. Like everything's tired, so it's like, hey, because of this, I never used to get them until my injury happened, and that's all it is. I usually get them every day, but sometimes there's bad days where I take the Tylenol.
Okay. And you said you had some vision problem or some kind of after effects from the surgery for your vision?
I just noticed that my eyes were straining a lot due to I always had a vision problem before. I had glasses before, but I never wore them because I was ashamed. And so, but after the injury, I noticed that I was straining my eyes a lot. So the doctor's like, just wear your glasses. But I also think too, because I'm on the computer, so when we chart and stuff, the screen's like right here. So I don't know, I'm not sure if I shouldn't wear them when I'm looking on the computer or what, but sometimes my eyes, like right now, they're tired. Like I could just feel like the pressure like this.
Okay. When is the last vision check that you had?
3 months ago.
3 months ago, and they just had your prescribed glasses?
Yeah, there was an instant where they thought I was getting glaucoma because the pressure on this side, the trauma side, my eyeball was kind of harder than the other side. So I had to go twice to get it checked out, and finally the pressure test or the puff test that they do was back in normal range. So he's like, okay, you're good, but he kind of scared me.
Okay, so he cleared you on that.
Yeah.
All right. How about your mouth? Do you have any sores?
No.
Any tooth decay?
No.
Any problem chewing?
Just chewing tobacco, but not food or anything.
Okay. Any gingivitis because of the tobacco patches?
No, actually, my dentist said my teeth are pretty healthy and my gums.
Okay. Any nasal problems? Can you breathe through both nostrils?
Yes.
Without a problem?
Yes.
Okay. How about your hearing? Do you have any hearing problems?
No.
When you swallow, do you have any pain, any discomfort, or?
No trouble swallowing.
Trouble. Okay. Any problems with your thyroid?
No.
Okay. Have you ever got your thyroid checked?
I did get my blood work one time, and the only thing abnormal was a prostate abnormality through my blood work. The doctor said, watch my diet, whatever I'm eating, kind of put more greens on my plate. So I did, and then I got my blood work done again. I did ask him because I wasn't losing weight like I used to. So maybe it was a thyroid issue, but after the prostate came back normal, never told me anything about my thyroid.
Okay. Any problems with your lymph nodes?
No, just when I do get sick or get like a headache or whatever, my lymph node where I had my hernia surgery, it swells. Like I could feel like there's a marble right there.
Okay. But no other problems other than the.
No other problems. You just tell me like when I'm sick or about to get sick.
Okay. And any problems with your respiratory?
No, I was on a ventilator though when I had my brain surgery.
How long were you on the ventilator?
I think about a week. I woke up and the tube was still in my mouth. I freaked out.
Okay. And did that cause any permanent damage to your trachea?
Not that I'm aware. I don't have any problems or any soreness or anything.
Okay. And how about your heart? Do you have any problems with your heart?
No, just I feel like I should get checked out on my heart because my grandparents have hypertension. And sometimes I get like this pain in the back of my neck, like I said.
Okay.
And being a paramedic, I'm like, oh, that could be high blood pressure. But I check my pressure on the monitor in the ambulance. Sometimes it is high, but when I check it, we've been running calls all day, so I'm like, okay, just calm down. But
Okay, and do they report high? You said that they report high when you check it on the monitor.
it's like 140, 144 over 92 was the last time I did it.
Okay, any problems or discoloration with your fingertips?
No,
How about your toes?
no,
Any swelling in your legs?
no.
Okay. So do you have any problems in your chest area, in your breast, or any lumps
No.
anywhere?
No abnormalities.
Okay. Do you have any problems with your gastric intestinals?
Only when I eat really spicy food.
Okay, but no constipation?
No.
No diarrhea?
No.
Would you say that your bowel movements are normal?
Yes.
How about when you urinate? Do you urinate pretty frequently?
I drink about 2 liters of water a day, so it's nothing out of the ordinary.
Okay. So no discomfort when you're urinating.
Yeah, no pain, no nothing.
Okay. How about your muscular skeletal? Do you have any problems? Any broken bones other than the one that you mentioned with your shoulder?
I did break my hand once. I was in a cast for 6 weeks from boxing.
Okay. And how old were you when that occurred?
16.
Okay.
No, yeah, 16, sorry.
Okay. And any other problems with any other extremities?
Not to my knowledge.
Okay. Any problems with your skin?
Not to my knowledge.
Okay. Any neurological, other than the surgery that you had?
Other than my surgery, my headaches, no.
Okay.
Or migraines, whatever.
Any thoughts of suicidal?
No.
Any depression?
No.
Do you have any anxiety?
Only when I watch football.
Okay. So any other questions at this moment?
No, I just hopefully, if we can, get my blood work done. That's it.
Oh, definitely, we can get you set up for that. And for right now, and that conducts our assessment for our health history. And thank you so much for your cooperation.
Thank you.